That little soreness in your gums when you brush a bit too hard, or maybe noticing they bleed more easily than they used to, can feel like just another annoyance that creeps up with age. It's something you might shrug off, thinking it's no big deal, just a part of getting older, right? But it's funny how something so small, something we don't always pay much attention to, can turn out to matter more than we ever imagined. It's a common feeling, isn't it, to assume our teeth and gums are separate from the rest of our health, like they're just along for the ride. Well, that's exactly why we need to talk about this surprising connection between oral hygiene and heart health, especially as we hit our 60s and beyond. You see, what's happening in your mouth doesn't stay in your mouth. It's tied to your heart in ways that researchers are only now fully piecing together. And it's something that can make a real difference in how you feel day to day. I know it might sound unexpected. How could brushing your teeth have anything to do with keeping your heart ticking strong? But stick with me here, because understanding this link can empower you to take some simple steps that protect not just your smile, but your whole well-being. Over our time together, we'll explore how this works, why those gums matter so much, what you can do about it with easy habits, and how it all fits into living your best life as you age. It's about feeling good, staying independent, and keeping your energy up for the things you love. Let's start with the big why behind this. You've probably heard how inflammation can cause trouble in the body. Maybe your doctors mentioned it about arthritis or a stubborn ache somewhere. Well, the same thing happens when your gums aren't happy. If you've ever had that puffy red look around your teeth, or maybe a dentist has warned you about gum disease, something called periodontitis, that's where this starts. It's not just a local problem. That inflammation can spread through your system like a quiet troublemaker, and it's been linked to something called atherosclerosis. That's a fancy word for when plaque builds up in your arteries, making them stiff and narrow. And when that happens, your heart has to work harder, and the risk of a heart attack or stroke goes up. It's completely understandable to feel a little surprised by that. I mean, who'd think a little gum trouble could reach that far? But studies show folks with gum disease are 2 to 3 times more likely to face those heart issues. That's not meant to scare you, but to show you how much power you have to change the game. Think about someone like Mary, a friend of mine who's in her late 60s. She's always been active, loves her morning walks, and keeping up with her grandkids. But a couple of years ago, she started noticing her gums bleeding when she brushed. She figured it was just age. Maybe her toothbrush was too hard, and she let it slide. Then her dentist pointed out early gum disease, and not long after, her doctor flagged some higher blood pressure readings. It wasn't until she connected the dots with her doctor that she realized her mouth might be part of the puzzle. She started taking better care of her teeth, brushing more gently but consistently, adding flossing even though she'd always skipped it. And over time, not only did her gums feel better, but she felt more in control of her health overall. It's something many of us find as we get older, isn't it? Those little shifts can add up. So, what can you do about this inflammation piece? It's simpler than you might think, and you don't need fancy gadgets or expensive trips to the dentist every month. First, brushing twice a day, but doing it right, makes a huge difference. Use a soft bristled brush, because those gums deserve some gentleness, especially if they're sensitive. Take your time, maybe 2 minutes, and angle the brush where your teeth meet your gums. That's where the trouble likes to hide. Pair that with a toothpaste that fights bacteria, nothing too complicated, just something you can grab at the store. And if your hands aren't as steady as they used to be, an electric toothbrush can be a game changer. Less effort, same results. It's about keeping that inflammation from getting a foothold, and that's a step you can start tonight. Another piece of this heart health puzzle is the bacteria itself. You know how a cut on your finger can get infected if you don't clean it? Well, when your gums are inflamed or bleeding, it's like an open door for bacteria to sneak into your bloodstream. And once they're in there, they can travel straight to your heart. It's wild to think about, but those little germs can stick to artery walls or even infect the lining of your heart, something called endocarditis. For us, as we get into our 60s and 70s, our bodies don't fight off infections quite as easily, so this matters even more. I've seen it with my neighbor Jim. He's 72, loves his garden, but he had a scare with chest pain last year. Turns out, he'd been skipping dental checkups, and his gums were a mess. His doctor said those bacteria might have played a role in his heart acting up. He's fine now, but it was a wake-up call. Here's the good news. You can shut that door on those bacteria with something as simple as flossing. I know. Flossing can feel like a chore, especially if your fingers aren't as nimble anymore. But even doing it a few times a week helps. If threading that string feels tricky, try those little floss picks. They're easier to hold and get the job done. Or, if you're like my cousin Linda, who swears by her water flosser, that's an option too. Just a quick spray between the teeth while you're watching TV. The point is to clear out the gunk that brushing misses so those bacteria don't have a chance to party in your mouth. It's a small habit, but it's like putting a shield up for your heart. So, while flossing is like your first line of defense against those pesky bacteria, there's another everyday habit that can team up with it to make a real difference. Rinsing with an antimicrobial mouthwash. It's not about drowning your mouth in something harsh. It's just a gentle swish to knock back the germs that brushing and flossing might miss. Think of it like giving your gums a little extra love, especially if they're feeling tender or you've noticed that redness creeping in. I remember my friend Dorothy, who's 68 and swears she's got more energy for her bridge club now that she's added this to her routine. She used to skip it, figuring toothpaste was enough. But after her dentist nudged her about gum trouble, she picked up a bottle of the stuff you can find at any drugstore. Nothing fancy, just a quick rinse after brushing. And she says her mouth feels fresher, and her last checkup showed her gums looking healthier too. It's a small thing, maybe 30 seconds while you're getting ready for bed, and it's easy on the wallet. If your taste buds aren't keen on the sting, there are milder versions out there. Find one that feels right for you. It's all about keeping those bacteria from setting up camp and heading toward your heart. And this relates closely to something else that's key as we get older. Staying on top of those dental visits. I know heading to the dentist might not be anyone's idea of a good time. Maybe it's the sound of that drill, or just finding the energy to get out the door. You're certainly not alone if you've put it off a time or two. But here's why it's worth it. A professional cleaning, even just once a year, can catch those early signs of gum disease before they turn into something bigger. It's like getting your car tuned up. You don't wait until it breaks down, right? My pal George learned this the hard way. He's 71, loves his fishing trips, but he hadn't seen a dentist in years because he figured his teeth were fine. No pain, no problem. Then he started feeling run down, and his doctor linked it to some inflammation that might have started in his mouth. One good cleaning later, and he was amazed at how much better he felt. The dentist scraped away that tartar, stuff you can't get with a brush, and checked for pockets around his gums that could spell trouble. If getting there's tough, maybe transportation's an issue, or your knees aren't thrilled about the trip, ask a family member for a ride, or see if your community has a shuttle. Even one visit a year can lower that risk to your heart, and that's time well spent. Of course, alongside those checkups, there's this bigger picture of how all this ties into your overall health. You're not just protecting your heart from gum disease. You're giving your whole body a boost. Poor oral health can make other things harder to manage, like blood pressure, which so many of us keep an eye on as we age. When those gums are inflamed or bacteria are sneaking around, it's like your body's constantly fighting a low-grade battle. That can nudge your blood pressure up or make it trickier to control, and over time, that wears on your heart. I think of my neighbor Sue, who's 65 and always on the go with her gardening. She was frustrated because her blood pressure meds weren't working as well as they used to. Her doctor asked about her teeth, and sure enough, she'd been skipping the dentist and wasn't big on flossing. Once she got serious about her oral care, brushing, flossing, a little mouthwash, her numbers started looking better. It wasn't a cure-all, but it took some stress off her system. Does that sound familiar? It's amazing how these little pieces connect, keeping you feeling stronger for the things that matter, like chasing grandkids or tending to those roses. What's great about this is how doable it all is. You don't need to overhaul your life or spend a fortune. Brushing, flossing, a quick rinse, and a yearly checkup. These are small moves that add up to something big. It's about staying ahead of trouble so you can keep enjoying your days. Whether that's a quiet morning with a cup of coffee or a busy afternoon with friends. Your heart's been with you through everything, and these habits are like a thank you note to keep it going strong. So, you've got this rhythm going with brushing, flossing, and maybe a swish of mouthwash, plus that yearly dentist visit to keep everything in check. It's like you're building a little team of habits that quietly work together to look after your heart. Now, let's weave in one more piece that ties this all together. How what you eat plays into this mouth-heart story. It's not about turning your meals upside down or giving up the foods you love. It's just about making some smart tweaks that support your gums and, in turn, keep your ticker happy. You know how sugar can stick to your teeth and cause trouble? Well, for folks like us in our 60s and beyond, cutting back on sugary snacks or drinks can do wonders for your oral health. And that means less strain on your heart, too. It's not that you can't enjoy a piece of cake at a birthday party. Lord knows I wouldn't skip that. But maybe swapping out that daily soda or handful of candies for something kinder to your gums makes a difference. Take my buddy Frank, who's 69 and used to sip sweet tea all day long. His dentist kept finding new spots of decay, and his gums were always irritated. He switched to water with a splash of lemon most of the time, still tasty, but no sugar to feed those bacteria. Over a few months, his mouth felt cleaner, and he even dropped a couple of pounds, which his heart appreciated. It's a small shift, right? If you're someone who loves a sweet treat, try keeping it to once a day and rinsing your mouth with water after. It's an easy way to keep those germs from settling in and stirring up inflammation. And this connects closely to another food angle, adding in things that actually help your gums stay strong. Crunchy veggies like carrots or celery are like nature's toothbrushes. They scrub your teeth as you chew and get your saliva flowing, which washes away bacteria. Plus, they're packed with nutrients that keep your gums healthy. I think of my friend Clara, who's 73 and still loves hosting Sunday dinners. She started tossing a few raw veggies on the table. Nothing fancy, just some sticks of carrot or cucumber, and noticed her gums didn't feel as sensitive anymore. It's not about forcing yourself to eat stuff you don't like. It's just sneaking in a little extra crunch here and there. Maybe while you're watching TV, you munch on some celery instead of chips. Same satisfaction, but your mouth and heart get a win. It's something many of us can manage, isn't it? Even if energy's low or cooking feels like too much some days. Now, as we've been chatting about all this, brushing, flossing, rinsing, dentist trips, and a few food tweaks, it's clear these small adjustments really can add up to feeling more in charge of your health. It's not about being perfect or doing everything at once. Maybe you start with brushing a little more carefully, then add flossing a couple times a week. Over time, you might feel your mouth's happier, and that's one less worry tugging at you. It's completely understandable to feel hesitant at first. Change can seem daunting, especially if you're juggling doctor visits or just trying to keep up with life. But these steps, they're gentle. They fit into your day, and they're a way to say, I've got this, to yourself and your heart. Here's the thing. You deserve to feel good, to keep doing the things that light you up. Whether it's a walk in the park, a laugh with friends, or just soaking in a quiet moment. These habits aren't chores. They're little gifts to yourself that keep you going strong. Be kind to yourself as you try them out. Every bit counts, and even one small win is worth celebrating. I'd love to hear what you think about all this. What's worked for you, or maybe a tip you've picked up along the way? Drop it in the comments below. It's amazing how we can learn from each other. If this chat's been helpful, give it a like. It lets me know you're with me. And subscribe if you want more ideas for living well past 60. Take good care, and here's to making every day a little brighter.